Okay, Assalamualaikum and a very good day to all of you. So today we will learn about depressants abuse. We will touch a very basic about depressants drugs and its tendency to be abused. What are the list of depressant drugs available? And we want to look at the physical effects of depressants to the body, and also some issues regarding the abuse of depressants in Malaysia. And we will also discuss the withdrawal symptoms, intoxication of depressants, and also the management of depressants abuse. So what are depressant drugs actually? So these are the substances in which it will suppress the normal function of the brain and central nervous system. So it is in contrast with what the stimulants would do. So it will suppress the CNS function. So they lower or depress arousal levels and reduce excitability. Okay, so these are the names of uh, depressants drugs, and of course all the drug abusers or drug addicts, they do not call the drugs by the actual name. So they have nicknames for all the substances that they use. So for example, they can call it as downers, red birds, red sleeping pills, tuies, zombie pills, yellow things like this. Okay, and there are four types of depressant drugs. So they can either be sedative, hypnotics, tranquilizers, or anxiolytics. So sedatives, basically it suppress both cognitive and physical function, so it will make the people sleep. So this is commonly when, for example, in medical use for patients that needs to be intubated in the ICU. So we need to suppress their function, the cognitive and physical function, so that they will not their reflex will not tamper with the process of intubation. So we need the patient to be sleeping during the process. So we give them sedative. Hypnotics will induce sleep only. Tranquilizers, it will slow down the function of CNS. So it will just slow down, might not necessarily be asleep. For example, tranquilizers, antipsychotics, or benzodiazepines. So antipsychotics are the medication that is being given to treat schizophrenia, for example, or any psychiatric disorder. So we want the patients to be to slow down the activity so that they do not have the manic episode. So it does not necessarily knock down the patient wholly. Anxiolytics is to treat anxiety. So the mechanism of depressant drugs, it acts as an agonist to GABA receptor. So you have learned GABA receptor before, right, in the pharmacology lecture. GABA is the chemical in the brain that sends messages between cells. So increasing in GABA activity causes a slowing down in the brain activity. Okay, so GABA is the um, neurotransmitter that slows down the brain's activity. So this depressant drug is agonist or similar in terms of function or chemical structure to GABA. So this causes a relaxing effect that is helpful to people with anxiety or any sleep problem. So these are the lists that we will touch in this. We will touch only some of these lists of depressant drugs. So we will look at the barbiturate history. So barbiturates are one of the depressants. It is first used as sedative hypnotics, in which it will induce sleep and reduce anxiety. So it is founded in 1864 by a German chemist Adolf von Bayer, and it is commercialized as Veronal for its sedative and hypnotics use. So this is the first brand name for barbiturate in 1903. And phenobarbital synthesized and discovered to alleviate night seizures. So phenobarbital has been used to also treat night seizures as well. And it has become popular in 1960s and 1970s. But then because of the potential abusive effect and also addictive effect, so its use has been declined. And also at the same time, benzodiazepine is becoming more popular. So yeah, barbiturate is quite an old drug actually. So we have three groups of barbiturates: short-acting, intermediate-acting, and long-acting. So you can see more of the long-acting actually in the for the medical use. We have in oral, IV, or IM injection, but it can also be available in any of these preparation. But not all of these preparations are available in Malaysia. It has narrow therapeutic index. You have learned narrow therapeutic index before, I think. Um, Only a small changes in the concentration will cause if it's on the lower in the lower concentration, it will not make any effect. If it's on the upper range or upper limit of the concentration, it will give side effect. So it has a very narrow therapeutic index. Only slight differences in dose may cause different effects. So small doses um, can cause the patients to be drowsy or in disinhibition, lack of restraint, impulsivity, disregard social norms or misconduct, so they become drowsy in small doses. However, in higher doses, they will be having drunkenness, slurred speech, or confusion. And even in higher doses, more higher doses, they can even get into coma or having respiratory depression or even death. Okay, so this is the danger of barbiturates. Actually, the overdose of the barbiturate can actually kill because it will suppress the respiratory function. And there is also a cross tolerance to alcohol and benzodiazepines. So meaning here that if one people has been using barbiturates and then they develop tolerance, meaning that they will always need to increase the dose to get the same effect. And then once they stop the barbiturate and then they use benzodiazepine, so probably the lower dose of benzodiazepine will not work as well. So they also need a higher dose for benzodiazepine as well, because there is a cross tolerance between barbiturate and benzodiazepine. So dependence can develop after 1 month of daily use of barbiturate. So it is very fast actually. Only the use of 1 month they can only already develop addiction. So that's for barbiturates. So second group is the benzodiazepines. So we can see in the hospital now we use more of benzodiazepine as compared to barbiturates. So it was discovered by this Austrian chemist 1954 by Dr. Leo Sternbach while working for Hoffmann La Roche. So the first benzodiazepine patented and introduced was under the trade name of Librium. Okay, and then in 1963, Valium was introduced. So Valium is um, a more popular trade name for diazepam. So diazepam is um, one of the benzodiazepine agents. So benzodiazepine was indicated for anxieties, insomnia, seizure control and as anesthetic during surgery. So it was more popular used for patients undergoing surgery in which we need to knock down the patient so that the surgery can be done. So we need to give them depressants. So we also have three groups: ultra short acting, and long acting benzodiazepine. So ultra short acting, it acts less than 10 hours. It will be in the body. For example, midazolam, triazolam. So short acting 10 to 24 hours, alprazolam. We call it Xanax. It's more popular as Xanax, which is one of the earlier trade name for alprazolam, clonazepam, lorazepam, or clomazepam. And the long-acting one, the example is diazepam, so it will act in for more than 24 hours. So regular use can cause very serious physical and psychological addiction. So it is also very prone for addiction. Tolerance to the intoxicating effect develop very rapidly. Tend to increase the daily use of 10 to 20 times the recommended therapeutic level. So abusers can actually increase the daily dose at a fast rate. So they can achieve up to 20 times the recommended therapeutic levels if they take it every day and at a regular basis. So of course it has a cross tolerance to barbiturates. So that's it for the benzodiazepine. So we have now two very old drug. The earliest one is the barbiturate, and then because of the risk of addiction, more people are using benzodiazepine. This is for the medical use, but then benzodiazepine also can cause tolerance or dependence, and it's also prone to for addiction. So the third one is the chloral hydrate. Okay? Chloral hydrate is the first hypnotic ever marketed in 1832. Hypnotic is to induce sleeping. So onset is 30 minutes and duration is an hour. So it is only can be used for a short period. So the effects only for 1 hour intense. So people can use chloral hydrate. They combine with alcohol. It's called micaffeine, and the criminals has been using it to induce sleep for the person that they want to rob, for example. And it has been widely used from the end of 19th century until around 1950. So because chloral hydrate has potential for abuse and dependence, it should only be used on a short-term basis. So it is also has a potential to be addicted when you're using chloral hydrate. Only the use of 7 days can already develop, the patient can already develop the dependence towards chloral hydrate. The date rape drugs. So now we come to the issue of depressants drugs being used as date rape drugs. So you can see here, this is a very common scenario that we have heard before, that when a person is trying to have a bad intention towards the girl, and then when the girl is not looking, the man spiked the drink, and then the girl drank it, and then she was knocked down, and then the bad guy can do whatever he wants to that girl. So for example, rape or do sexual assault. And we can see here that there is an alarming concern about the sale of date rape drugs online. So it can be it is available online. So we have to be aware of these kind of issues, because this is also part of our social responsibility as pharmacists to ensure safe use of medication. And this is the one company in the US. They have developed a test kit that can test whether your drink has been spiked by by date rape drugs. What are the date rape drugs actually? So what are the types of drugs that can that usually being used as date rape drugs? The first example here is flunitrazepam. So we also call it as rohypnol, or the nicknames are roofies, rufinol, forget me pill, or rope. Okay. It is often used in surgery procedures to put patient into conscious sedation, in which patient is asleep and will not be able to recall events if they wake up during this period. So for this drug, whenever patient was given this drug, when they asleep and then they wake up, they cannot recall an event that occurs. Okay, so this is like the perfect drug that can be used for the rapist. Okay, flunitrazepam emerged in the mid 1990s as an illegal drug in the US, and it was being abused recreationally and associated with sexual assault. And the onset is fast, 30 minutes. The peak is within 2 hours, and it can persist for up to 8 hours, depending on the dosage that we put. The second one is nimotazepam, Arimin 5 or Happy 5, a hypnotic, sedative, anxiolytic, and skeletal muscle relaxant. So it is a derivative of benzodiazepine, particularly popular among persons addicted to amphetamine or opioids. It can be used to overcome the withdrawal symptoms. So basically, when the when the drug abusers are using amphetamine stimulants, or they have been abusing opioids, they have the uh, withdrawal symptoms of insomnia, or they can be depressed, or they have exhaustion. So these withdrawal symptoms can be alleviated by using benzodiazepines. But Arimin 5, it can also be used as the date rape drugs as well. GHB, gamma hydroxybutyrate, is also one of the date rape drugs. It is available in either in the powder form, or in pill, or in liquid, and it has no odor, it has no color, and we would not be able to taste it. So uh, if the bad guy is using this GHB, they spike the drink with GHB. The girl will not be able to identify anything different, or anything weird with the drink. So that's why it can be done successfully for them. Okay, so the taste can be masked with but it has like a bit of the salty taste, but it can be masked when added to other beverages like soft drinks, or the alcohol, okay, liquor or beer. So onset of effect is 10 to 20 minutes and can last up to 4 hours, and you can only use for small amount, but it can give big effects. And the effects can be dizziness, drowsiness, a dreamlike state, loss of consciousness, vision problem, loss of memory. It's also the same with flunitrazepam earlier, rohypnol. The patient or the girl cannot really recall what happens when they wake up, and slow heart rate and beating rate. Okay. So these are the routes and the form of the formulation of GHB. Another one is ketamine. So ketamine is uh, it is still being used for medical use in the hospital, in which it is used for anesthesia, general anesthesia. So when the patient is undergoing major surgery, so the patient needs to be on anesthesia. So ketamine is one of the option. It is available in liquid or white powder form. The onset is very fast, because it is being used now for anesthesia. So we need the action to be very fast, especially when it's given in IV. The effects, you might know what is happening to you, but you are unable to move. So that's even scarier. There is a potential loss of memory while being drugged, and it can also cause hallucination, distorted perception, out of body experiences, and also loss of sense of time and identity, and slurred speech. So this is when it was used in excessive doses. And we also have here non-benzodiazepines, the Z drugs. For example, zolpidem or zolpiclone. It is suggested to have a little liability for physical dependence. Long-term use is not recommended as tolerance and addiction can occur. So it can also um, induce tolerance and addiction. But the effects is quite different. The patient can actually sleepwalking while using zolpidem, and the patient can also have erratic driving. They cannot really get what they are doing. They are intoxicated by the drug. They cannot really think. They can do a lot of peculiar things or weird things. Okay, and it has duration of action of 6 to 8 hours. So, what are the general effects of depressant drugs? So generally, we can see that it is divided into two types of effects depending on the dosage. So low dose can reduce anxiety, relax muscles, and can induce sleep. And the patient can have slurred speech, shallow breathing, visual disturbances, decreased alertness and concentration, disorientation, lack of coordination. In high dose, however, it can also have a greater effect on the consciousness. So people uh, can have a total loss of consciousness. They can have memory impairment. They can have paranoia. They can have suicidal thoughts. So it also affects psychologically. And the effect on sleep specifically, it will reduce the time to sleep onset. So actually benzodiazepine group has also widely being prescribed for patients with insomnia or patients with psychiatric disorders. For example, depression, they cannot sleep well, they have problems sleeping. So benzodiazepine is one of the treatment actually to promote sleep. So in a good way, because it can also reduce the time to sleep onset. So the patient can it's easier for them to sleep. It will reduce wakefulness after the sleep onset, so it will improve the quality of the sleep, and it will increase the total sleep time and reduce REM sleep when used. But it will also reduce the REM sleep when used at a higher dose than indicated, and also increase the ease of falling asleep. And reasons of abusing or misusing these depressant drugs. So it can be used to um, self-medicate when you have been using amphetamine type stimulant. For example, um, you have the feeling of jangled nerve, a feeling of irritation, the anxiety because of the effect of the stimulants. So the addicts are actually countering the effect by using depressant drugs. And also, when uh, the addict is using hallucinogen type of drug or substance, for example, they can have the flashbacks uh, of the trip. You will learn in the hallucinogen lecture later on about the flashback, the trips. So they are associated with anxiety, and then they want to tone down the anxiety. They will use depressants. And also, if they use heroin, so they can have the withdrawal symptom. They can also ease the symptoms with depressants, and also as a mean of suicide. So there can be a lot of reasons for suicide as well, including psychiatric disorders background, or a lot of different social factors. But in using the depressant drugs can be one of the ways for the patients to uh, have a shortcut, take them in overdose, and then it will cause the respiratory depression, and then it can also end up with death. These are the examples of the um, common depressants, the sedative hypnotics, for example, benzodiazepines, barbiturates, and the non-barbiturate sedative hypnotics. And these are the daily dose and also time needed to produce the dependence, and the time before onset of withdrawal and also peak withdrawal symptoms. So the warning signs of depressants abuse. So how would you recognize that the person near you is actually abusing? One of the factors that affect and do a lot of things, so they can change the pill with someone else, or can go to different doctors. We call it doctor shopping. They can go to complaining about their symptoms of insomnia, for example, hoping to get the depressants or the benzodiazepine just to induce sleep, and then they will get each time they go to the prescription, so they can have a continual supply of the depressants. And also forging prescriptions, because benzodiazepine can only be supplied, or we can only get it with doctor's prescription, and it is also regarded as the dangerous drug in Malaysian pharmacy law. So there's a lot of documentation before we can get it. So that person can also forge any prescription just to get a dose. Stealing or borrowing a friend or loved one's prescription. They can also purchase benzodiazepine illegally through online or any black market. So these are the scenario in Malaysia. It's probably changing now, but the depressant, it belongs to the others. So jenis dadah yang diambil, so it's the others type. It's not that much, but we can see here that the teenagers are using it more than the adults. The withdrawal symptoms it may include within 24 hours. It may include anxiety, insomnia, loss of appetite, nausea and vomiting, increased heart rate, excessive sweating, tremors, and abdominal cramps. So the symptom peaks for short-acting benzodiazepine is within second or third day of abstinence. So when they have used it before for a long period of time, and then they suddenly stop because there is no supply anymore. So on the second and third day of short-acting benzodiazepine absence, they will have the symptoms of the withdrawal is at the peak. Whereas for the long-acting benzodiazepine, for example, diazepam, only on the 7th or the 8th day of abstinence, they have the peak of the symptoms. And it can also lead to convulsion, seizure, delirium, or psychotic state. So when the person is having a withdrawal symptoms, there is a pharmacology treatment for that. So for example, for benzodiazepines, withdrawal symptoms, we can give them lorazepam. So this is the short-acting benzodiazepine, just to alleviate the withdrawal symptoms that they have. Okay, so it's the same drug that is being used to treat withdrawal, but we use the short-acting benzodiazepine just to treat the withdrawal. Whereas for barbiturates, we can give them pentobarbital tolerance test, and then the dosage can be tapered down over several days depending on the symptoms that the patient still have. How to prevent the abuse? Actually, so we can whenever we want to prescribe to the patient or dispense to the patient benzodiazepine, benzodiazepine or barbiturates or any depressants, we have to choose agents with less degree of tolerance and dependence. For example, within groups, benzodiazepine is the better choice instead of barbiturates. Okay, and the treatment with depressants optimally should not exceed 4 weeks to minimize the tolerance and dependence. Okay, and also when you want to discontinue the depressants, you cannot abruptly discontinue. So you need to taper down the dose so that the patient do not experience the withdrawal symptoms. Okay, because the an abrupt abstinence or stopping of the dosage will cause them to develop this withdrawal because they have started to be dependent or tolerant to it. And also we have to educate doctors, pharmacists or other healthcare workers in management of benzodiazepine withdrawal in long-term users, and educate doctors and public about prescribing the drugs with less abusive potential, and also avoid the use in patients with a history of drug abuse. So if the patient already have a history of drug abuse, regardless of the type of drug or substance being used, we try to avoid using benzodiazepine or barbiturate for them. And also there are other alternatives to treat anxiety. For example, bucipron. It is an anxiolytic uh, drug, and it can be used instead of the benzodiazepine. And also sedating antihistamine like hydroxyzine or diphenhydramine to treat insomnia or anxiety. And also melatonin is to induce the sleep to treat insomnia, and also any herbal treatment. But however, in Malaysia, we do not actually treat them with this herbal preparation, but it can be used as an adjunct treatment for insomnia. These are the references that I use in this lecture, and feel free to send me an email or just PM me for any questions. Okay. All right. Thank you. Bye.